uh, what is happening with the Carlton Waterline project right now?
Well, the Waterline project is actually going really well. It's they're moving right along on that, and I don't know. I think they're looking at early November to have it finished, but it's gone, I think, more smoothly than they had anticipated, because you never anticipate something's going to go smoothly. But yeah, they're really happy with that. We're dredging. They started the dredging, and there are some issues there. There's a little bit more of a soil. The soil that they're dredging is different from where they were testing. I'm not sure exactly the whole technology of that, but anyway, they're experiencing a little more turbidity than they had expected. They have these huge tubs, or laid out to put the water into and for settling, and it's not settling like it should be, and they're getting a little more turbidity downstream than they had expected, which, needless to say, DEQ and folks are not pleased about. So they're working on getting that resolved. So the dredging is actually slowing down a little bit. But that's where we are with that. Bigger news right now, of course, is that yesterday they learned that there was an individual at the pool for one of the pool sessions.
Mayor, I was not able to hear you. You said there's a person at the pool, and then it cut out for me. Yeah, I can't hear you.
Okay, it just said my internet connection is unstable, so I don't know what that means.
I can hear you now.
Oh, okay. Yeah, I couldn't hear you either. So it says my internet connection is unstable, so.
Well, we're working on that.
Yeah.
So what happened with the person at the pool?
They tested positive for COVID. They at least, did let us know. So they closed the pool immediately yesterday when they were informed, and it is closed for the season, because by the time they get it reopened, we were going to close on the 5th anyway. So, we're just going with that.
Oh my gosh.
Yeah, that was kind of heartbreaking. They worked so hard to get that open and do everything they could to cover all the bases. These things happen. So we've got that. And then I was just informed that the department heads talked it over and decided that as of tomorrow, starting tomorrow, the city hall will be closed to the public again.
Okay. I was wondering about that.
Yeah. I don't know what other city halls are doing. I haven't really looked at that, but our guys are pretty careful, so I'm not surprised.
Yeah. And then YC schools were delayed, I was told, were delayed in opening from previous week to this week, or can you update us on that? Do you know?
I don't know exactly what's going on there. I know they have some concerns too, and they were delaying opening, trying to figure out what they were going to be doing, but I haven't had an update on it, so I don't really know what they've got going on.
And then can you remind me of the status of the sewer and sewer treatment plant project? You need more money for it, right?
Well,
or do you have it?
We always need more money. We were very fortunate to get the $5.8 million grant that Representative Noble helped us with.
Right.
So we got that. Between that and the $447,000 that we got just straight from the feds on the ARPA, we've got that, and then our the developer that's going to benefit the most from some of the sewer treatment is prepaying his sewer SDCs. So with that, we've got just enough to cover I think the upgrades on the pumping stations, and because we have 3 pumping stations in town. So that'll cover the upgrades on that and take care of, I think, our main sewer line. We still are looking for assistance to help us get in and dredge out the settling lagoons and work with those. Those haven't been touched in quite a while, and they're losing volume. So we need to get those done too. So that's
it sounds like there's a theme here where you need to scoop stuff out.
There's a lot of scooping going on. Yeah. I won't finish that bit. No. But,
well, hopefully it's cleaner upstream.
Yeah, cleaner upstream. Now downstream, I don't know what to tell you. We just can't stop people.
That's true. You can't stop people.
Yeah. Oh, yeah. We've been the other thing that we're dealing with, and I had not, I think, really been aware of how long it had been since some of even our main lines, water lines, had been replaced. And I don't know how the water is getting from our delivery system into people's homes, because we're getting, I think the Public Works did like 5 water leaks in 1 week, and they were mainline leaks, and they pulled out the one piece of pipe. I can't easily put a picture of it up, but they pulled out one piece of pipe and brought it into Shannon's office so she could see what they were dealing with. And it's about a 4-inch pipe. And it was just, it had holes everywhere. I mean, it looked like an irrigation pipe or something, it's cast iron, and it had one place where it had already been repaired once, and there was no way they were going to repair it again. The corrosion inside of it and the corrosion outside of it, it's tremendous. And we're like that with, I think, all of our Main Street pipes and our, Yamhill and Pine Street, the main ones anyway. So that's going to be our next project, I think, once we get some of this stuff done, because we're probably losing, once again, who knows what percentage of water just to leakage going through those pipes. And I'm sure that that we're not unique.
I was just about to say, and with that, Mayor King, do you have a similar problem in Amity? And welcome.
Hello, I'm glad to be here. I missed the first part of Mayor Watkins' explanation, but yes, we are all about replacing lines that are long overdue. I just read, we had our water study report come in, and we were at a 40% loss of water from intake to town, and we've reduced that by 11%. So we're saving over 1 million gallons just from the pull to the loss, but ongoing work. We also have some major stuff underway, but we have a whole prioritized list that we're going to keep working down. So definitely in the same boat.
Yeah.
And then Mayor King, Mayor Watkins was just telling us that the City Hall is going back to close to the public as part of the response to COVID surge. Is there any conversation in Amity, or what's the status right now?
So we've discussed it. Really, we have a pretty small staff and not much in and out. And so they are comfortable now. We're just put it out there. Masks are required by everyone, and continual reassessment. I'll talk to everyone tomorrow, see how the feeling is and how that's going. But really the mask and the distancing, everyone seems to be comfortable with that at the moment. Before, we did do it by appointment only, and that worked well. So if we need to move in that direction, we will.
Yeah. And we were doing appointment only, and then it was one person at a time in the office. But they kind of decided last this afternoon that starting tomorrow, it will be if they do it at all, it will be appointment only. So.
Yeah, and the county, we have not discussed it yet, but our county administrator is not in the building at the moment, so he would be the one making these calls with our support. But there's so many different facilities and buildings at the county, and some of them have to stay open by statute, so it gets complicated really quickly. But the majority of the board has set as July 18th as return to in-person, in-building. So it's going to have to, clearly, it will have to require a majority of the board to move folks back out. But along those lines, as you all are probably very aware, there's some pretty intense new case counts for Yamhill County and for the state as a whole.
I was reading an article this morning about the firing of the school superintendent over in Aden because they didn't specifically say, people posit that it's because he was enforcing the masking rules in school, and it's terrifying.
I would say the concern for me is when it looks like somebody is being fired for following the law. That's the part that I think is most concerning to me, like separated out from masks or not masks, but he was following the law. Yeah.
And there's
Rachel, Mayor, you were about to say something. I'm going to change your name on your Zoom.
I'll do it. After tomorrow's council meeting, I will, if necessary, change it. Yes. So speaking to case counts, this morning I found this interesting. So back when we were doing metrics, the extreme risk category was 200 cases per 100,000. And over the last 2 weeks, Yamhill County has had 751 cases. So we're 3 times over what would have been called extreme risk. And I think because the messaging is different, people aren't realizing how extreme the numbers are.
Yeah.
I think you make a very good point. And that's, to be clear, the extreme risk was a category, it was a line that was set by the CDC too. Yeah. So it wasn't like it was an internal arbitrary or not arbitrary number. The CDC was like, this is what it looks like when you have a lot of spread within a community. So thank you for pointing that out. Sorry, Mayor Watkins.
Oh no, I was just agreeing with it. The other article I was reading about was, it was a conversation with the folks in Pendleton and some of the other Eastern Oregon about the fact that the outdoor spread too is greater than they had originally anticipated. And certainly we've all been, I think, a little more cavalier about being outdoors without wearing masks. And from what I pulled out of that article, that's probably been a bigger contributor than we realized to the case counts and what's happening. So hopefully we'll start paying attention to that too.
Yeah, that's a really good point. I know that for at least our family, it began like we got the information, we built it into our brain that like it's okay to be outside, right?
Right.
It's okay. Outside is okay. It's great, in fact. So I think at least for us and probably for other people, it's hard to relearn that, especially when you're sick of COVID.
Sick of being sick.
Yeah. I think that's a good point.
I was just thinking back, like 6 weeks ago, I popped on here and was like, oh, I need to get used to taking my mask off while outside. I feel silly. And now we're right back of like, oh, pop it on.
Yeah.
And I would say that, at least for me, Mayor King, you had mentioned, that we're actually much higher than the extreme risk, but the language and everything seems to be really different. And I've been trying to, when I look at the the research that's out there, and when people assess all the different interventions that are possible to slow down transmission, the one that has the biggest effect is limiting group size to fewer than 10. So like if you look at everything else, limiting group size is the most effective globally, but because we don't have specific guidance in our state right now, I find myself regularly canceling my presence at events that are important but don't have a virtual option. And it's unfortunately that's bad for our community because I'm not there representing the county, and then two, I don't get to learn and build relationships with these folks who the relationship building is part of the event, right? So I just need to figure that one out.
And I don't know what you do. We were just going back into everybody in a room for a council meeting, which we found, the whole dynamic and the whole discussion changes in that situation. I'm sure we'll be back on Zoom, next week. And it's really disappointing and pretty distressing in that sense, because I think we do a better job when we're face to face and actually having a conversation with somebody in the room. So that's it.
Yeah, agreed. Yeah. And Mayor King, you're still meeting in person, correct?
Yes, we will be. I spoke with our city administrator, and we just made it really clear that it's everyone's personal call. So we have space, we'll have the mask, but everyone, I'm confident that everyone will make the best decision for themselves, regardless of where they're coming from with that decision.
Yeah. And then I wanted to bring in, so it just says First Pres Zoom, but I allowed First Pres Zoom to speak, and they have a question in the chat. So go for it, and we can attempt to address it here.
So this is Matt Johnson. I'm pastor at First Presbyterian Church in McMinnville. So my question is, given the COVID situation y'all are discussing, which, we're at the peak for our county, many parents are worried about returning unvaccinated children to in-person school settings. I've got a junior hire who is vaccinated and an elementary school fifth grader who is not, because he's 10. So I'm wondering, is there any possibility of adding testing of some sort to the public school environment? Because I saw a CDC study that was showing, their kind of projected spread of COVID in a school environment with various settings, and the best was with masks and testing. It was about a quarter of what it would be otherwise.
And Matt, did you, so I only saw a version of that said Washington Post, and I was like, I'm a snob, and I'm not going to trust something that just has a media outlet. So that was from the CDC?
I believe so.
Okay.
I mean, we might want to fact check me there, but.
It was fascinating though. And if either mayors, if you haven't seen it, it's like under different, it's a modeling exercise, but under different sets of circumstances, including like how many people are vaccinated or have had COVID and still have sustained immunity, wearing masks, like how many people in the school communities will get it over time. I feel like I'm drawing with my fingers here, but you get the sense that when you have testing and you have masks and there is relatively high levels of either vaccination or natural acquired immunity, it's a fairly small number of people that will ultimately get infected. But when you take those things away gradually, it goes up much higher, right? So Matt, I think the numbers were something like in 3 weeks or a month in an unvaccinated setting. So when kids haven't been able to be vaccinated, it's like 91% of students get it within a month.
It was 107 days.
Okay, so
I don't know how they came up with that fairly strange number, but everything was over 107 days.
Okay. Right, and the curve, goes up very quickly and then tapers off. over time. Well, none of us here are. I think none of us here are school superintendents or board members. Okay, but I will say that it is compelling seeing that information about doing that surveillance testing. It seems like it would be worthwhile unless our schools are resigned perhaps to the fact that students are just going to get sick, which is unfortunately perhaps what some are thinking.
One of our counselors is also on the school board, so I'll check in with her and see what I can find out from her on that. Pick her brain a little bit.
And then Mayor King.
I do know that last year ODE and the state had those resources available. So I can't speak to if they will be available in our schools, but that's something that parents could advocate for. And with your own superintendent would probably be best, because I know, I'm not sure the exact channels, but I know they're out there and can get to our schools. And it sounds like that would be great to be able to offer for people who were interested and could make a positive difference.
Wow, that's great.
That's a really good point. Yeah, the surveillance testing versus either quick rapid tests or tests for folks who are either have been exposed or are symptomful. But yeah, Matt, I think that's probably the best starting point. And I can help make that connection too if you need.
Yeah, that'd be great.
Okay. But I appreciate the question, even if we don't have perhaps the most satisfying immediate answer to it. We do continue to see vaccination rates go up in the county, or numbers of people getting vaccinated. But we also, unfortunately, are seeing hospitalizations continue to increase in the county and across the state, as you all know. My hope is that we see something beyond just a mask mandate, simply because if you look at data, you can see what works. And with only some people wearing a mask, it's not going to slow down anytime soon. And I've talked to people who are like, well, we're all just going to get it inevitably. But right now we're seeing the results of lots of people getting it all at once. And people who've had it and are now getting it again. Yamhill County last year acquired through an Oregon Health Authority grant a refrigerated trailer in the case of a mass casualty event, not because of COVID, but because our planning showed that at some point we would need it, just as an emergency response. And we have sent that down to Josephine County because they can't handle the number of bodies that they have. And so that's an incredibly tragic thing in my view, that if we slow transmission, we can keep people out of the hospital and keep it from being overwhelmed. And this was the thing that, last year, Mayor Watkins and I were on this repeatedly on this, our roundtable, talking about keeping case counts low so that hospitals didn't get overwhelmed. And here we are now. And I just want to note, Mayor King, here we are now, as you noted, well beyond the extreme level of spread in the community with hospitals overwhelmed. So if you all have any thoughts about that, I welcome them.
I think there's the human nature aspect of we're all tired. We're tired of these restrictions. We're tired of the hypervigilance, and, you get wore down. So, maybe that's not where everyone's coming from, but even with the best of intentions, we're human and it's gotten old. So hopefully, we can just ramp back up and do what needs to be done, take what precautions we can, mask, vaccinations, being outside, smaller groups, they're all going to help. And if all we can do is a little something to help, just please, everyone do your part in that, whatever you can do.
Yeah, thank you. Thank you for those thoughts. Mayor Watkins, you have a whole different perspective than us. Any thoughts?
I was thinking exactly the same thing. It's just so frustrating to try to convince people. And I mean, I even find myself, my husband and I walked out the door and got halfway downtown. We just got a new ice cream shop opened here in town, by the way, and you need to come up and try their ice cream. It is to die for. Well, maybe it's not that, but I mean, they make their own ice cream, and it's.
Thank you for that clarification.
They have adult flavors too. Over 21.
Oh, okay. I was like, oh, does this require a driver's license? It sounds like it does require a driver's license.
Well, it requires you to be over 21. So, yeah, they've got
form of ID.
they make their own. It's the same folks that opened up Park and Main Pizza, and their ice cream was getting popular enough. They just opened up a little candy and ice cream store next door to it. But we were halfway downtown, and both of us looked at each other and went, oh, shoot. And we had to turn around and schlep on back to the house and pick up the mask and get on down there. And it's just like, oh, my God. But, I don't know what else you can do. There just is nothing else that we don't have any other options right at the moment. So we just need to make the best of the situation that we're in.
Yeah.
And, trying to explain that to people is, I'm not sure why it should be this hard. It's just.
Well, I take heart in, I read a great paper recently. I'm not a virologist, so mutations in viruses is still somewhat new to me. But I learned that they kind of categorize it as three things that we have to be concerned about. One is virulence, so like how bad it is for you when you get it, and then transmissibility, so like how easy is it to transmit. And measles is like the most transmittable. It's like an R value, reproduction value of like 62 or something. And then immune escape, and whether the virus is able to mutate enough that our bodies no longer recognize it, and we either get sick again if we had natural immunity, or that it escapes a vaccine induced immunity. And it sounds like, at least with the Delta variant, which is the one that is essentially the only one here now. I mean, it's more or less, it's the vast majority of cases, is more virulent, twice as transmissible, but it hasn't really moved in the direction of immune escape. So that's a very positive thing. And when researchers have looked at changing various parts of the spike protein to see whether our antibodies respond to it differently, they had to change 20 different things all at once in order to get our immune systems and antibodies specifically to not be able to recognize it. So there is some hope in there, and that vaccines and prior immunity is definitely still working on this particular variant. So I had a lot of hope in kind of seeing here's all these different pieces. There are some, including one that's like B1.2 or B1.1.2, which I don't think has a Greek initial yet, that it does appear to be, it's a C? No, it's a Kappa.
I think it's C.1.2.
Okay, not B.1.2. It's from London, or I think it's from London. That's what I heard, and it seems to be an immune escaped one for some people.
Oh, I apologize. I was thinking of a whole different thing coming up on the radar. Yeah.
Yikes.
I just want to add, this is a personal view, and it's not aimed at anyone, but it almost feels like the boy who cried wolf, because we're seeing these variants that we didn't expect in the beginning, that everyone was so shut down and cautious, that now when there's something, that's proving to be more dangerous in whatever ways it has changed, that there's kind of this feeling of, yeah, we've heard this before. And it's unfortunate. So, just be on the lookout. Things are changing every day.
Yeah, I definitely understand what you mean. And it was a part of, I mean, you know, the public health perspective, at least what we hear from our public health officials is, you know, restrictions keep case counts low so that there aren't those replication opportunities, right? Like the 20 different mutations that Delta would need in order to escape immune system are actually like, you know, billions of you know, it's one in many many billions of a chance, but because there's so many people who have so many different, like millions of copies of the virus in their system, there are the opportunities, right? So it's a matter of keeping the virus going at high levels means that we do get, unfortunately, the opportunity for more different strains. I do want to know, since we have folks here from Encompass Yamhill, that one of the very challenging things with the virus right now, and that having so many people sick and transmitting COVID, is that we have way more people who need to quarantine in either the motel sheltering project or the project turnkey motels than we have space for. So there's something like 88 households that are still on the waiting list who are in urgent need of shelter. So when people who are out in the community who don't have proper housing get sick, they have a really hard time quarantining away from, one, from other people that they might be camping with, but two, they still need supplies, right? They have to go to the store, they have to get water. So it's really, really challenging for folks who don't have stable housing to quarantine. I mean, it's challenging for people who do have stable housing, but for those folks, it's even more challenging right now. So just so that you are aware of, you know, the motel sheltering project has been very successful in continuing to move people from homelessness, chronic homelessness, to stable housing and on to long-term housing, but there's still really, really limited space compared to the need that's out there. And Pauline may be able to add to that, but she may choose not to. Okay, and then go ahead, Mayor.
Oh, I was just going to say, I had a question for Pauline, kind of going back to the situation that she was talking about last week, how that is progressing or not progressing, or what with the exposure that they did have with that. Here she can.
It's spreading rapidly, as we knew it would. So I have nothing proper to say at the moment about any of that, so I will keep my trap shut, except to say that it's spreading rapidly.
Yeah, and I'll just say that that for the community out there, and for two mayors and for Matt, that Pauline has been just a tireless advocate for making sure that people are safe across the community, including folks who are homeless and don't have a place to quarantine. So Pauline has my so huge thanks for all of your work, including just like pushing on the issue, because it's so important, especially when people can't advocate for themselves because they're trying to quarantine, and to have somebody advocating for them. Thank you. And you don't have to respond to that with anything, but I just really appreciate it. And I hope, mayors, that you know how much work she's doing to keep people safe and to get them into a better spot. And it's really hard. There's so many barriers to that work.
No, I would like to thank her as well, and then just say it's another example of our resources being spread too thin. Just like we were trying to avoid this with the healthcare system, it's another super important resource that has just been stretched to its brink, and all the work that has been done to avoid this is now happening. And there's 88 people that don't even have a place to quarantine when they need, you know, help.
I second those comments.
Yeah, it's super important. And thank you, Pauline. Pauline has to leave, but she heard you. So thank you for that. Anything else that you all want to tell the community or you need to keep in touch with? I will say that the county is working on drafting a request for information that we'll send out to the cities about water issues and funding water issues specifically. So keep that in mind. It's moving slowly, and apologies for that.
If only the water were. Also, I just want to once again express our thanks from here for the help that we've received from the county with regard to the maintenance of our section of the rail easement. Your parks guy has been tremendous and has, I think, it seems like we've been trying to work with Shannon, our city manager, as far as doing the best he can. They did some great cleaning. Unfortunately, we're starting to see some regrowth, so we're going to have to go after it again. But he has been just wonderful. So our appreciation goes out to the county for all of that assistance.
That's great to hear. That's very great to hear. We want to keep your chief happy.
Well, we do want that too. But
I mean, we want the space to look nice and be safe too, but we also want to keep the chief happy.
Yeah, we want Terry happy, definitely. We really want Terry. We like having him smile. But in fact, the first cleaning that they were doing out there, Shannon had gone out and she saw something in the shrubbery a little bit off the trail and went, "Oh, what's that?" and picked it up. And it was a backpack that had been stolen a couple of weeks previously that had just gotten thrown into the bushes back in there. So we know that, a lot of people use that section. Mm-hmm. And they use it for all kinds of stuff. There are houses that back up close to it and people are aware of a lot of things. But, nighttime things happen. So
we need to make it into a park for you, clearly.
We would love to see that. It already does get a tremendous amount of use just from folks in the city. I walk it a couple of times a week. I know that I have friends all over who walk it.
And we've lost you again, or at least I lost your audio. It's that darn unstable internet, which I'm working on. And to that end, you should know that right now there's a request for information from local internet service providers so that we can gather the information in order to put out for bid an expanded broadband project. So specifically, we're looking as a county to fund the physical infrastructure to get high-speed internet out to the most remote rural areas, but also to increase that the density is what it's called, the density in the small cities. Amity is totally set, I realize that, but other places aren't as totally set as you.
I have not experienced this type of issue until I think it seems like the last month or so we've been having these problems, and I'm not sure if it's the weather, the smoke, or what's going on, but yeah, Xfinity is pretty much our provider, and it's been pretty good. So I'm not sure what's happening.
Weird.
Yeah, it's very strange.
Well, and I will say Amity does really well, but right outside of town, Eola Hills, anyone there is valleys that they are just out of luck. So I know that they provided some input, but they need help.
Yeah, and we the county helped fund the building of four towers, and then part of the physical infrastructure on the towers. But so one of them is going in the Amity Hills because there's, you have the fiber coming down, I think, to the school, right? And then there's fiber going out to a repeater tower at the edge of the Amity Hills. But so then the southern and western hills have almost nothing, and because the fibers are not there, and then there's no wireless transmission. So there's one tower that's specifically going to cover the Yola Hills with the high-speed wireless specifically. And it's not 5G. I had somebody on the social media being like, "You're funding 5G." I'm like, no. This is just your basic, like, aerial internet.
Thank you. I know that will make a world of difference to a lot of people.
Yeah, there's something like 1,100 households that are in the Amity Hills who don't have access. It's a lot of people, and it goes from Whiteson up and over. So specifically, when Online Northwest came to us with a funding request, it was to target Whiteson specifically, and then go up and over the mountain there, or the hills there. So I think that one of the towers is going to be in Whiteson, and then there's another one that's either Perrydale that can see into the southwest Yola Hills, I think. But I should get the map for everybody. And then the hope is that we can identify the areas then that don't have it now, because it's cheaper, the wireless transmission. And it's cheaper for the ratepayer, but it's so expensive to put fiber in the ground. So the hope is that we can then identify other pockets across the county that if we put a tower, we fund one tower, it can get this 12-mile radius. So we saw one, Bonamici, Congresswoman Bonamici and I went to a tower that's on Highway 240 between Yamhill and Newburgh, and that one has the power on it to transmit into all of northwestern Yamhill County, and then they're going to put a tower just over the county line on the north edge coming back into the county. So the area that has very poor service right now should have much better. So exciting.
Did you say it's like 12 miles?
The big towers have a 12-mile radius. And it's still point of line of sight. So then they have like the big towers are the ones that are, they're very large. And then they send it out a mile or 12 miles. And then for the little canyons that don't have that direct line of sight, they're locating new spots where they can put these smaller towers that have about a 1.5 to 2 mile radius that they can then repeat in. I'm like pointing around here. Because there's some areas that just they'll never be able to get it from a centralized tower.
We're lucky for our topography, but it has its drawbacks.
Yes, exactly. And none of us built our homes thinking, "Oh, I need to have this direct line of sight."
Yeah. I wanted to comment just when you mentioned Highway 240, it reminded me, I enjoyed your explanation of the traffic control and how traffic, how speed limits are set, particularly for the people up on Bald Peak, because I know, having driven up there a few times, I know what they're dealing with. And, we all in the county get frustrated. And so it was an interesting insight into how ODOT decides how fast people can go.
Yeah, it's the weirdest thing, that, and this is counterintuitive. So hopefully folks out there will learn from this and get mad at ODOT, and then they can change things. ODOT can change their mind, but that if people are driving faster than the speed limit on your road, and you ask the county, say it's a county road, you ask the county to reduce the speed, that's actually not what will happen. Is that the county will have ODOT come out and do a speed study, and they'll look at how fast people are driving on your road, and then they'll take 85% of that, and that they'll set that as the speed limit, which means that counterintuitively, if you are a resident of an area and say your speed limit is 45, but you want it to be slower because people are driving too fast, if the county does a speed study, the speed study may indicate that really it should be 55, which is the opposite of what you want it to be. You want people to slow down. Which is a challenging situation, right? And the only way that we can really work with that is to introduce friction to the system by actually slowing down people by how they drive. But you can only do so much of that. You can't make your roadway narrower and narrower until it's not safe.
We struggle with that with the two intersections that we have here in town. The one coming from 47 coming down from Yamhill, and then you make the turn and go east and then head on down to McMinnville. And those are two, they're right angle curves. We've got massive hauling trucks, the big semis coming down through there. Plus, for some reason, ODOT on the east end took off any guidance for drivers. So there is nothing that says through traffic gets to go through. You don't have to stop. If you're coming north, you don't have to stop if you're making a left-hand turn. And we sit there, and I sat there one night just long enough to drink a cocktail and saw 4 near accidents. But they won't do anything about putting the signage up because there are no accidents, so we don't need to put a sign up. And it's like, the only reason we're not having accidents is because people are good enough drivers. They're hitting the brake fast enough. You take your life in your hands going through that intersection, whether you're walking or driving. And the same with the other one. And they won't give us the signage or the street control that we need because we're not having any accidents.
Right. That's a really good point, actually. It's sometimes in rural areas specifically, if there's a corner that's a sharp corner and people don't know about it, it'll be a site that there's people who drive off the road all the time. But if the county or ODOT doesn't know that's happening because the accidents aren't reported, or the runs off the road, or the smashing into a garbage can, if it's not recorded, then there's no ability to use that information to improve the scenario, right? Or to get ODOT to take action on it, because they're like, well, there's no problem here.
I don't know. We've got to figure out some way to get these people to hit each other and start recording it, I guess, because that seems to be the only thing that's going to have an effect is if we kill somebody on one of those intersections. And it's just so, I sit in the mornings, especially in the mornings, because the traffic is getting so heavy with morning traffic, commuter traffic going up to Washington and Multnomah County, coming out of McMinnville. Sorry, but yeah, that's what they're doing. They don't go down to Dundee. They just run on up Highway 47.
Well, Mayor Hill's not here, so, you can push it all you want.
I'm taking the city's name in vain, and that's just, you and I have already talked about this. It's going to get worse and worse. It already, Carlton should not have cars backed up for a block waiting to get around through an intersection. And we do, on weekday mornings, we do.
Mayor Watkins, have you had a traffic study done?
Oh, we have had more than we even want to talk about. And every single time they just say, no, there's no problem here because nobody's getting hit. We're right now, of course, in the middle of and we don't want to disturb ODOT too much because we really do want to get there. They're looking at doing a reroute of Highway 47. So we'll have our main street back and the highway will go around there. So we're trying to be a little more diplomatic with them as far as how we're dealing with some of these things. But that will help somewhat. It's still not going to help the poor people that live on Pine Street and on Yamhill Street where they come in from the north and south, but it'll at least get the traffic off of Main Street and give them a little more of a throughway so that it's not quite as dangerous. But we'll still have the intersection there at on the east end that we're pushing for a stoplight for, and they keep saying, oh, you don't have the warrants or whatever that is for it. There's not enough traffic coming through there. So we may have to do a few months of recruiting people to drive through there right when they're doing the traffic study and see if we can. I don't know. It's just.
Oh, and right for that intersection, it's people coming in on Hendricks, right? Hendricks to Main, who are because that's not as busy of a side as 47 as a through, right? They don't want to put a light in there, right?
Well, it didn't used to be, but
Mm-hmm.
it is becoming busier and busier just because a lot of people right now, especially, are kind of looping around and avoiding Lafayette and what's going on down there.
Right.
The other thing for us is that we just put in, we're just finishing up the second new subdivision down on the east end of town. So those folks are probably going to be coming up and going up, commuting up to Washington and Multnomah County. And, that was the other news, is we just got a request for a zoning change for a third subdivision down in that same area by the same developer. So we were hoping to get our comprehensive plan and our code updated and cleaned up a little bit before that happened. And I don't know, my city manager said we've got 6 pre-applications right now in planning, and this one is the 20th. We'll have the zoning, the city planning commission do the first public hearing on that. And I don't know how many, this is just the zoning change, so we don't even know how many houses he's planning on putting in. But those other two for Carlton, we haven't had any major planning or growth here for 15, 20 years. And now we've got 50 new houses there. We've got a 22 unit apartment building and then a 10 unit apartment building that have happened within a year. And another one coming. So we're not prepared for this. We just weren't. So Mayor King,
yeah, that's a lot of growth. Sorry, go ahead.
It's a lot, and it's way too fast, and it's just coming. Yeah, it's just coming at us like a cannonball, and we're not experienced to deal with it too. We don't have the knowledge to deal with it, and that's really scary. Yeah, Mayor King, I wanted to ask how things were coming with the questions you had about the judge.
Oh, we're just working on getting documents together and really being informed before we do anything.
Okay.
Kind of where we're at.
You're getting what you need from us? From our city manager?
I haven't checked in this week, but
okay.
I'll be talking to Mike tomorrow, so I'm sure Shannon has been super helpful, so we're not worried about it, but we appreciate the cooperation. Thank you.
Yeah. Okay. I just want to make sure, but I figured she probably was. She's pretty good on that. Sorry.
Definitely.
I'm rattling on.
No, it's okay. I need to get going. We've had our hour, and I really appreciate both of you mayors joining me and talking about your areas and also about this tremendous surge in cases that we have right now in our community. Thank you for being leaders in your communities.
Super quick, redistricting public hearings next week, Wednesday and Thursday for us. I just want to put that pitch out there.
Yes, thank you. And what that means is that you all have the opportunity to provide input and to get lines adjusted in congressional and legislative districts if you want to. And if there's, for some people, they're like, oh, this should change to this. Well, this is your opportunity. And if you go to, you can type in Oregon Legislature redistricting, and you'll see both the links and the information on the legislature's website.
Thank you. Thank you for the
Thank you,
reminder.
Commissioner.
Yeah, thank you. Remember out there, wear a mask, get vaccinated if you can, and keep your group sizes small. I mean, that's what we're doing. It helps everybody a little bit, as Mayor King says. It helps. So use your judgment. We can do this. All right, we will see you next week.